and welcome to another episode of A Closer Look. In this segment, we will highlight the Safe Children Healthy Mothers or SCHM project aimed at reducing stunting among children ages 0 to 5 years, reduce family violence, and promote healthy practices in the communities. In addition to the establishment of mother support groups in the communities to promote maternal, infant, and young child practices, the implementation of nutrition-sensitive projects by the community development committees was another way the SCHM used to promote healthy practices in the communities. This was seen recently during the newly commissioned aid post in Sarkim village in North Wasera local level government, Wasera Gawi district in East Sepik province. Tamara Agavi reports.
The CDCs are made up of village councillors, women and youth representatives. The CDCs were taken through the Community Action Planning or CAP process to improve their knowledge on appropriate nutrition practices, identify health and nutrition issues, as well as solutions, and finally prioritize, plan and implement one project. In agreement with the CDCs, the SCHM provided a portion of the startup resources and materials, while the CDCs and community members took care of the remaining cost of the project. Save the Children through the Safe Children Healthy Mothers aims to create peer support groups of pregnant and lactating women and mothers of children under the age of 5 to increase knowledge and improve pre- and postnatal maternal, infant, and child nutrition and feeding practices. Community grants as the community aid post will work within communities to increase their support for healthier nutrition behaviors. Ronnie Inaha, project manager with the Save the Children, elaborated on the nutrition project and the aid post.
Papua New Guinea, especially along all places where service you need to delivery, to support him agenda, plan long government. NGOs, people come, you mean no come because you mean like delivering program or you mean like visiting people or you mean like looking palace or NGOs, especially Save the Children now, people come start work long. I civic, you mean be any tasol agenda of the government. You got plan. You mean aligning more activities or work you mean be any big plan of the government. Now you mean delivering or programs you mean. Inside this specific program now you mean running long Sarkim nutrition program.
In Sarkim community, the CDCs conducted a community sensitization on nutrition learnings from the training and agreed to construct a house marathon for iron supplementation of pregnant women and minor treatment of childhood illnesses like fever, respiratory infections, and minor infections. The community leaders liaise with the district health team for medicine supplies. Ronald Naki, project coordinator with Save the Children, gave a highlight of their projects in the district and province.
So what we tell the community PHA team is that what we build there is not belongs to Save the Children. We normally supported them, and that is part of our strategy to fill the gaps, especially in terms of health services. We see where the lack of services are and where the gaps are. We try to step in to fill those gaps up. So that's one of the things that Provincial Health Authority and District Health Authority, they work close with us to support them in make sure every communities in the rural areas, at least they receive health services in their communities.
Other community-implemented projects that Save the Children are also working closely with communities are kitchen gardens for households, fish farming, chicken farming, and water tanks for safe drinking water. Lazarus Kopidiktu, a local from the Sarkim community in North Wasara LLG, said that the community needs a health aid post due to the distance that is from their village to the nearest aid post.
That took 10 kilometers. Save the children coming here because before we play with Panim Hatru or Mama got him beginning or Mama got Belna or like all delivering beginning long have. So Pan Hatru go here. Now it's a time like come now, save the children come here now, put in the hospital or little aid post and local now or some sub health center. I'm good for more we play about 2 sabati Mama. And just passing along 7 because time flat is a come, what a title is lap, we play hard crossing slap. I'm long way distance go and Kaukian and one piece. Also, at time when was a set of children now, we play come in. We play Amastrula, we play come because we play somebody Mamala, all walking around, legally one and some time was put out 2 leap come down, hard locking bed na car him. Also, now, good play come and play Amastrate.
Overall, the CDC engagement has demonstrated solid community participation, strong community ownership, and effective sustainability. The SCHM project is supported by the Australian government through the Australian NGO Cooperation Program or ANCP. The district and provincial health authorities gave assurance of support to the newly commissioned aid post as well. Speaking to the community during the commissioning, Stephen Massey, the district health manager, assured the community that the health aid post is in the provincial plans. A community health worker will also be recruited as well.
So display minimum sarkim inside lo plan lo PHA only capturing you inside lo plan blow. When them budget lo you when them something time will give him lo mibla ba mibla sindan to one tip lo leaders making by lo sawe when them funding lo ibla when them support lo ibla come lo help him disla facility. Through some disla project emi bin come up lo side lo partners lo mibla all to all by put him house marasin. So after lo mi bin wo ko ambla visit lo mi go anta lo kaugia. Mi talk to one time why see lo kaugia na mi documento mi ba mas go na looking disla place sarkim pastem because all PHA only capturing him inside lo plan lo mi bla mas kirapi on blade post.
Society help him long kirap him this blouse how sick sabay long all doctor now nurse now Marasin Mary lo wak bu montem long alright him all man Mary he got sick help him all sick man Mary now beginning stop long this how sick.
When I'm out, mi looking now sana blo here mi minimum sem em no finish blongan. Pak black extension all display ba PHA ba mi look extend him go in up ba meet him isla extended el post inside the community. Oh yeah. So all time display mi got representative blomi bla lo ESPHA em staff. Where em ba kama ba sem custodian do display service ba provided inside the community so ba mi give ki go lo representative blo PHA. Sisa Tagora you can come forward na ba you cut him ribbon. You me ready lo singa ora hip 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 hip.
The program is supported by the Australian government for 4 years and is aimed at reducing the prevalence and impact of chronic malnutrition or stunting among children from birth to 59 months and to develop social norms that promote zero tolerance of any form of violence against women and children.
We now take a quick break, and when we return, we highlight the current runway upgrade at Kagamega Airport in Western Highlands Province.